All right, now time for the EMT Module 1 EMS Systems quiz. We'll walk you through the questions and some answers. If you need additional practice, there is another quiz in PDF form that will be linked below, as well as a study guide. All right, let's go. What is the primary goal of EMS? A, to prevent illness in the community. B, to provide immediate emergency care and transport. C, to assist law enforcement in emergencies. Or D, to conduct health research. The answer is B, to provide immediate emergency care and transport. EMS exists to deliver timely emergency medical care to definitive care. Which document led to the major reforms in EMS in 1966? A, the Orange Book. B, National EMS Scope of Practice. C, EMS Agenda for the Future. Or D, Accidental Death and Disability Report. The answer is D, Accidental Death and Disability Report. The 1966 Accidental Death and Disability Report exposed EMS deficiencies and pushed for change. Question 3. What level of provider can administer IV fluids and a limited number of medications? A, EMR. B, EMT. C, AEMT. Or D, paramedic. The answer is C, AEMT, or advanced EMT. Advanced EMTs can administer IV therapy and a limited set of medications. Question 4. Which of the following is considered part of scene safety? A, writing a PCR report. B, asking for law enforcement backup. C, refusing to wear gloves. Or D, ignoring traffic hazards. The answer is B, asking for law enforcement backup. Calling for law enforcement when needed helps maintain scene safety for responders and patients. Question 5. Which agency originally published the National Standard EMT Curriculum? A, FEMA. B, NHTSA. C, Department of Transportation. Or D, the CDC. The answer is C, the Department of Transportation. The U.S. Department of Transportation, or DOT, created the initial EMT training curriculum. Question 6. What should an EMT do first when arriving on scene? A, start CPR. B, check equipment. C, ensure the scene is safe. Or D, begin taking vitals. The answer is C, ensure the scene is safe. Scene safety must be established before a patient contact to prevent further injury or danger to you or the patient. Question 7. Who is legally responsible for the medical direction of EMTs? A, the EMT's partner. B, the ambulance company. C, the fire chief. Or D, the physician medical director. The answer is D, the physician medical director. A licensed physician provides medical oversight for EMT protocols and practices. Question 8. What is the most effective way to prevent disease transmission? A, wearing goggles. B, using hand sanitizer occasionally. C, frequent hand washing, or D, avoiding all patients with any symptoms? The answer is C, frequent hand washing. Hand washing is the single most important step in preventing the spread of infection. And probably most important, if you're going to do something like eat or touch your face or rub your eyes, wash hands when you can. Question 9. What kind of EMS provider often arrives before EMTs and provides basic care? A, paramedic. B, nurse. C, advanced EMT. Or D, EMR. The answer is D, EMR. EMRs are often the first on scene and provide basic life-saving support until EMTs arrive. Question 10. Which of the following is a sign of EMT burnout? A, increased energy at work. B, hyperfocus on details. C, emotional numbness. Or D, asking for days off. The answer is C, emotional numbness. Burnout may manifest in many ways, but it may manifest as emotional numbness, exhaustion, and withdrawal from duties, and that's something you might be able to see. If your partner is experiencing these symptoms, definitely talk to them, offer your support, and suggest that they talk with a supervisor to see what resources are available to them. Thanks for watching. Hopefully you did quite well on this first module quiz. Please like and subscribe if you found this useful. And like I said, there's a whole nother quiz below, linked in the comments. There are access to other resources like a study guide for this module that might help you as well. If you have any questions or I got anything wrong, throw that in the comments and let's talk about it. This is how we learn. We'll see you soon.